Welcome everyone to our NCAA social series. I'm Andy Katz, and I'm pleased to be joined by three esteemed doctors. Dr. Brian Hainline, who is the NCAA Chief Medical Officer. Dr. Deena Casiero, she is the Director of Sports Medicine and the head team physician at UConn. And Dr. Goerl, he is the Director of Student Health at Kansas State. For those that have been watching the show for the last 18, 19 months, it's been going on quite well. We've covered COVID-19, obviously, health and safety for student athletes and everyone, quite frankly, at all levels of sport. And we've obviously rode the roller coaster of this pandemic. So let's just start off with where we are at this stage with the Delta variant. Obviously, numbers are going down, but we don't want to be, change everything just because of that. But numbers are going down in all categories. But let me just ask you, the three of you, and I'll start with you, Brian, just where we are right now at this stage in the pandemic as it relates to college athletics.
Well, thanks, Andy, and it's great to be here again with you, and especially with Kyle and Deena. So look, we're at an unusual place because the fact of the matter is that we still have hospitals that are over capacity, and we're still having way too many deaths. But as you said, with the Delta variant, infections are going down across the country and in most communities. And we sort of seen two things play out. One is that, yes, this is a highly contagious variant, and even those that are vaccinated, they are and they have been susceptible. But it largely became from the point of view of serious illness, a disease of the vaccinated versus the unvaccinated. And that may be one of the most important lessons that we've learned, that essentially for those that have been vaccinated or have an immunity, that this became like a flu or an upper respiratory infection. And that was kind of always our hope, that we would get to this place where if COVID-19 doesn't go away, that it becomes another endemic upper respiratory infection that we can manage. So that's sort of how this is playing out right now. And obviously we hope that Delta will leave this country as it has other countries.
All right, so Deena and Kyle, and Deena, go first, please. At the campus level, how have you seen things change once the fall semester began and now into it?
Thanks, Andy, and thanks for having me on the show today. I certainly think this fall semester has looked a lot different and a lot more positive than the previous semesters, and I think that has all to do with our vaccination rate. We are approaching 95% vaccinated on both our campus and within the athletics population at UConn. And I think that that's made all the difference. We do see vaccinated individuals test positive, but it is far more infrequent than the unvaccinated. And I think overall, it's been definitely a move in the right direction.
Kyle?
Yeah, I think things are generally positive for our community locally. Hospitalizations down, cases are down. Our percent positivity rate is as low as it's been in several months, which is encouraging. But I think it's important to keep in mind that this is very regional, and there are certainly areas in the country that are still struggling. I mean, if you look at the shape of things in Alaska right now, they're certainly having a lot of difficulty up in the north, and so where resources are scarce, it can still be a very troublesome variant. But I'm encouraged. We're starting to look to the future. Second semester looking a lot more normal around our parts, largely because our Delta wave seems to be heading out.
So I want to address the current fall sports, fall championships, and then I want to get to, obviously, our winter sports as we wrap up this conversation. But let's first deal with fall sports, the majority of which, outside of women's volleyball, for the most part, are all outside. We've seen packed stadiums. 100,000 fans in some institutions, obviously, in those stadiums that can hold that. We're not seeing widespread outbreaks. A lot of these stadiums are requiring vaccination proof or negative test to get in, not all. So that's all positive signs, but they are outside sports, outside viewing places. So how much do we sort of look at that and not get a false sense of security, Deena, and then we can go around our group with what's happening right now on the ground.
Yeah, it's an excellent point. We've always known that outdoor is safer than indoor. We've always tried to message that across the board. And so you're right. I think we're seeing a lot of success with outdoor sports, but we can't relax. We can't go into winter sports that are indoor and think that we'll definitely have that same outcome. And that's why a lot of our conversations center around what mitigation strategies do we need to focus on in the winter sports? Do we need to have everybody masked? Do we have to consider, proof of vaccination? These are the conversations that are ongoing and things that we're really tracking on, because while it's like Kyle mentioned, vaccination statuses across the country are vastly different. And so when we think about a packed indoor basketball arena with close to 95% of the fans vaccinated, we are far less worried about an indoor packed stadium where there is a large percentage of unvaccinated fans. And so that's why our push, our message is always vaccination, vaccination. That's what's going to get us through this pandemic.
Kyle?
Yeah, I think it's difficult because obviously Deena and I are in much different areas of the country, and they're different. Politically, they're different in their drive to get vaccinated. I live in an area that does not have the same vaccine rates that Deena has the luxury of. And so where we're trying to be good stewards is what we can control. And what we can control is what happens in our building. And so as we look to indoor activities, I think masks are extremely important. And my primary role is to protect the student athletes. So that's what I'm really focusing on is how can we make sure that what happens in the crowd does not necessarily affect what happens on the court. And so those that are working in the facilities, how can we ensure that they're vaccinated? If they're not vaccinated, how make sure they're tested and at least masked? And so those little things, this multi-layered approach to try to keep the risk to the student athlete as small as it can possibly be, and then do everything we can to get our student athletes vaccinated. And some teams are fully vaccinated, which makes it a heck of a lot easier to manage.
But Brian, and we've talked so many times about this. Yes, it's regional, but at the same time, it really is more school specific. And I look at Louisiana as an example, because LSU and Tulane in the state of Louisiana, were mandating for fans and for students once FDA approved it. So it really can get down to that level of the actual institution, more so than necessarily the state or how the state is run. How have you assessed the way, at least in the early fall, things have gone, especially, as I mentioned, in those packed stadiums with 100,000 fans?
Yeah, so you can measure it in two ways. One is just looking at the student athletes in general and the rates of vaccination amongst the student athletes, even in areas where politically it's sometimes more challenging to get that message through. Because of the way the medical advisory group structured their recommendations of that vaccinated individuals are only tested when they're symptomatic, but the unvaccinated have to undergo regular testing. And because of some of the conferences weighing in and saying, look, if you don't have a team that can play because of COVID, it's going to be a forfeit. That will be a loss. So that really helped drive up vaccination rates among students across the country, among student athletes. And in terms of, the fans, so the NCAA doesn't have a control over what happens in conference games or individual games in terms of setting a mandate for the public and so forth. Recall that we did have certain restrictions for fans during the championships and in the winter championships and the spring championships. But so far, we don't have any compelling data that having the fans even, toward maximum capacity, that's led to regional outbreaks. But because we don't have that data, it doesn't mean that it doesn't exist, but we haven't seen that has happened. But, in terms of the fans, that always is going to be a local decision maker unless the federal government or the state were to step in.
All right, so let's look ahead to the fall championships. And if you can, if any of you want to take this on, of the difference that may be obviously a little bit different with volleyball because it's indoors, but what is the plan with however it may be mandated, whether it's student athletes, coaches, fans for fall championships, especially when that is something, as we discussed, that you can control because the fall championships fall under the NCAA's jurisdiction. I'll start with Deena, if we can maybe go around our room here.
So I think, what Brian said in terms of it being locally, regionally related, I think there is still some weight to that. So even though the NCAA is sort of throwing the fall championships, where those venues are located, there are some local public health guidelines that need to be considered. And a lot of what we've done as far as advising is making sure that schools are paying heed to what their local guidance is.
Kyle?
Yeah, and then it's trying to be fairly uniform in what the recommendations would be to championships in various locations, and things like making recommendations to keep student athletes at least 6 feet from the crowd, making sure they're masked when they're not participating. Those are the types of things that we can apply universally that are relatively easy interventions, and appear to have been effective to this point in time. We haven't lived through an indoor Delta season except for what's going on in volleyball currently. But what we did last year seemed to be very effective in keeping student athletes safe and keeping competition active.
So you mentioned volleyball. Brian, do we have any data on what is happening with that sport, with the athletes, obviously, and the fans being indoors?
So far we don't have any data that indicate that that's led to sort of a local spread because of the fans or because of the athletes actually participating indoors. One thing I think is very important to point out, excuse me, about the upcoming fall championships is that most of them occur in a period of 3 days. There are a handful that are 4 days and maybe rarely 5 days. Contrast that to, say, the women's and men's Division I basketball championship, when we had everyone together for up to 3 weeks or a little bit more. And so we had to develop really extensive protocols and think about containment zones and so forth. Because we're recommending right now for the unvaccinated, even before championships, that they have the equivalent of 1 PCR test a week. As long as they have that test before they arrive to the championships, we don't have to do surveillance testing on site, and we'll only be doing symptomatic testing, and then setting up, regular or sort of a controlled environment, but not as strict, as it had been with the Final Four, where we had to really measure every single step virtually that was taking place. So it is different just because of the nature of the length of duration, and because we are in a better place. I mean, the vast majority of the student athletes that will be competing in the fall championships will be fully vaccinated.
So I want to go back to Deena's point then, so I'm clear on this. For a fall championship athlete or coach or fan, there can be an advice of whether or not they should be vaccinated or proof of a negative test to be on site, but how much will that be determined exclusively by the rules of either the city, the county, or the state of what they require for an event of a certain size, of whether or not that individual has to either be vaccinated or proof of a negative test within either 48 or 72 hours?
Well, so we're going back to the Tier 1 model. So the Tier 1 are the athletes, the coaches, the officials, those that are really part of that intimate group that essentially are those actively involved in competition. The NCAA will be overseeing that aspect of ensuring that you're either vaccinated or not. You don't have to be vaccinated to compete in the championships, and that if you're not vaccinated, you will have to show a proof of a negative test within a couple of days of the championship. And then everyone would undergo testing if they're symptomatic, but we won't be doing any further testing on site. So we do have control over that Tier 1 group.
All right, what overlaps, as I mentioned, with the championships is the beginning of winter sports. Obviously, you mentioned men's and women's basketball. Hockey will start. Later in the year, I know wrestling. So all these sports we discussed last year will start, for the most part, in November and December. Deena and Kyle, if I can go to you on this, I mean, how much will this be advice versus really coming down to what are the rules on that particular campus, city, county, and state?
Yeah, so where we see this conversation really light up is around masking for fans and or vaccination status for fans, right? So the athletes are all going to be following that same recommendation from the NCAA about either you're vaccinated or you're getting tested weekly. So that takes care of the athletes. But for the fans, I really think that that's where things are going to come down to the local guidance. There may be basketball arenas where there are no vaccine mandates, and there may be not even mask mandates. And that isn't something that I don't think that the NCAA is going to be able to rule on. That's the local public health guidance that comes into play. So that's where I think we're going to see a lot of sort of this, division of how things are handled on the local level.
Kyle?
Yeah, and it's going to play out in the public eye. I mean, I think Dean is absolutely right. You're going to have some stadiums where you look out, they pan across the crowd, everybody's masked. Others going to be completely unmasked or at least sparsely masked. And as has been the case with a lot of the pandemic, we obviously haven't lived through this yet. What effect will that have on local community spread? That's going to be determined at the time. We don't have a crystal ball. We can't predict that. And so that's a lot of pressure on local health officials to do what they think is best for their communities.
Brian, I'm going to get you on the last word here in a moment, but before I do, I just want a very quick comment from Deena and Kyle. You guys mentioned at the beginning about it being sort of different. It's not obviously 2019, but it's different, and we hope that maybe second semester will be even better. I'm just curious, since you're both at the campus level dealing with student athletes on a daily basis, just help me out here understand just the mood, the optimism, the attitude, especially the mental health of student athletes now versus let alone a year ago, maybe even 6 months ago. Deena, then Kyle.
So I'm super proud of the athletes and sort of how they're handling really the brutal nature of what they've been through the past 19 months. I think when we were isolated, when athletes were home, they were separated from their teammates and their coaches and their sports, it was devastating for them. And when we got them back on campus last year, there was this mix of they were super excited to be back, but then there were all these rules and all these guidelines and all these things that made it seem so foreign compared to what they were used to. And now we're here, we're back, we're playing. There are still guidelines, there are still rules, but the rules are a little bit rolled back. And also we're seeing less cases and we're seeing less positives and we're seeing less shutdowns and less cancellations of contests. So I think in that aspect, the mood is optimistic. But I try to, at UConn, remind my athletes that we are not out of this yet. So please do not let your guard down and really remember that, we are still very much in this. So I try to balance that hope and that optimism with a little bit of reality.
Yeah, I think it's the same thing here. There's cautious optimism, but there's a lot of caution in that optimism. There's the reality that we are basically back to normal classes. There's all the normal pressures of what that means in terms of midterms and finals, and so we see all of the anxiety that typically comes from school, compounded by the potential for testing positive for COVID. What does that mean for my team? What does that mean for me personally? But what I think I've seen is a new ownership. The fact that there is some level of normalcy coming back into play, they don't want to lose that. And I was at football practice the other night, and one of our senior linemen, I saw him rip one of the new kids, younger kids, who was in the cold tub without a mask inside, and it was just kind of like, what are you doing, man? What get your mask on. And so I think that they're saying, this is our chance. We can have a great season. We can rally together. We can continue this momentum. and hopefully push on into a successful winter sports season, so long as we're still together in the process. And so that was, I thought, is great leadership to see, and I think it also speaks to how much it means to these kids.
That's a great anecdote. And Brian, I want you to have the last word of the flexibility here. We're obviously cautiously optimistic that what you may think needs to happen in November, hopefully may not be necessary in February or March. I mean, how guarded are you that things might be pulled back a little? I'm not going to hold you to it. No one should. But that things could definitely work in everyone's favor if everyone takes care of business, as Kyle and Deena were saying. That things could certainly change over the course of the winter season.
Well, I would say, Andy, I'm guardedly incredibly optimistic. But we can, it's interesting when you go back almost a year and a half ago when a phenomenal document came out, Opening Up America Again, and that became the basis of our first core principles of resocialization of sport document. They really focused on syndromic surveillance and understanding what's happening at the community level. And that became the basis for moving from phase 1 to phase 2 to phase 3. And in many ways, we're there. We're seeing that we're going from red zones to orange zones, and then we'll hopefully be moving to, yellow and green zones, which means that a green zone, you have very little rate of new infection over a period of 7 days. And if we're there, and there are many predictions that we hopefully will get there, the way we do things will be much, much different than when we're in red zones across the country where we have to still do testing. So I think now that we have these systems in place and we understand the rate of spread, remember a year and a half ago, we had very little idea what the real community spread was because we just had such poor testing capabilities. So I think with the advance of everything, and even, with Kyle's anecdote that, we're just all looking at infectious disease and upper respiratory infections a little differently. It's a collective effort. I think with all of that, we can be optimistic. COVID has taught us that we keep our guards up, but I'm optimistic.
Well, I'll tell you. First of all, as if you were to go to our ncaa.org/social series page, you would see Brian at the beginning of all this talk about where we were then and to where we are now. So if you contrast show 1 to show, I've lost count, you certainly would see just how far we've come. But I appreciate all of you. Every time we have one of these, I learn more. I think they're incredibly educational, informational. And I'm hoping that everyone in our college athletic space is taking this all in and still taking responsibility for themselves and others, as Kyle was saying. So appreciate everyone. Thank you for your time. We'll be back again soon. Thanks for watching.